Welcome to Connect. On today's program, we're talking about the importance of breastfeeding. It's not only good for our health, but for our environment too. Mother's milk is fresh, local, and sustainable.
Hi, my name is England. I am the breastfeeding coordinator and lactation consultant here at the Women, Infants, and Children program.
My name is Susan Martinelli, and I'm the breastfeeding coordinator for the peer counseling program here at the Marin County WIC program. I'm also a lactation consultant.
Today we're going to talk about the importance of supporting our mothers when they choose to breastfeed and the barriers that they do face. One of the barriers was not enough support and guidance from their healthcare providers when it comes to breastfeeding, and also not enough referrals to our lactation consultants or staff who are well trained in breastfeeding so that they can get the appropriate help. So when the babies are delivered at the hospital, one of the barriers that they face is the mothers and babies are separated and they're not in the same room, and that's very crucial for breastfeeding establishment, as we know that the first 2 weeks of birth is crucial to establish breastfeeding. Other barriers that they face is some of our healthcare providers or even healthcare professionals might not be as knowledgeable when it comes to breastfeeding education and even breastfeeding help. Barriers that also come within the community. Communities do need to become more aware and promote positive messages when it comes to breastfeeding, and as well as families.
Babies were born to be breastfed. Breastfeeding is our legacy in the biological world. When that doesn't happen, there's consequences to that. Babies who are not breastfed actually have a higher infant mortality rate. They have higher rates of certain illnesses, sudden infant death syndrome, gastrointestinal illness, respiratory illness, even some cancers. Now they're showing a link between obesity and not being breastfed, lower intelligence quotients, so IQs, for kids who are not breastfed. For moms, it's even more impressive, some of the benefits of breastfeeding or the concerns about not breastfeeding. Moms who don't breastfeed have higher risks of breast cancer. That's a big one in our county. Osteoporosis as they age. There's even some concern that the bond between a mom and a baby is enhanced by breastfeeding and is actually more difficult when a baby isn't being breastfed. So there is some concern about the mothering styles of women who don't breastfeed. Breastfeeding has benefits for the family. It costs a lot less. There's a substantial savings. There are quite a few environmental risks or consequences of not breastfeeding. One of those is the production of the milk. There's a huge environmental consequence of all those cows needed to produce the milk that's turned into baby formula. A good portion of the soy that's produced in our country is turned into baby formula. There's metal that needs to be used. There's a lot of energy cost with all the processing. And a lot of waste, attributed to all the cans and all the bottles and all that stuff associated with artificial feeding.
Another barrier that the families do face is also the routine supplementation of artificial baby milk that is not medically necessary, and that really jeopardizes their establishment of breastfeeding.
Formula is just that. It is a processed food. It has a few of the things that are similar to breast milk, but it will never, never equal breast milk. Breast milk has hundreds of very subtle ingredients. It changes over time based on what the baby needs. As the baby grows, different situations. If a baby is sick, the mom, by breastfeeding, actually produces antibodies and passes those through her milk back to the baby. So it's an ever-changing mixture of things that are designed specifically for the needs of that baby. Formula can never do that. The WIC program is a supplemental nutrition program for women, infants, and children that was started by the USDA in 1974. Based on studies that showed that women, if they had better diets, they had healthier children. And so that's why WIC started. And it identifies certain nutrients that are key to child development, and so we provide education for healthy eating, but also supplemental foods that will be appropriate for moms and children. In recent years, we here in our WIC agency, we've gotten a USDA grant to develop a peer counseling program. And a WIC breastfeeding peer counselor is a WIC participant who has breastfed and has been trained to support other peers in breastfeeding. And peer support has been found to be very, very effective. Instead of just having like someone that has no relationship to that particular mom telling them what to do. All of the WIC staff knows how to address some of the common breastfeeding issues and questions that moms have. We also get a lot of referrals from local clinics and other healthcare providers to provide more hands-on through our lactation consultants. If a mom has a problem that's a little outside the scope of maybe a peer counselor or some of our staff. So one of the biggest concerns, and the one that we would like to address, and we're working on that, is that so many moms don't think that they are making enough milk. And almost always that's just a perception. It's very unusual, very rare that a mom truly doesn't make enough milk. And so we'd like to be here to help them with their confidence, and also if they truly aren't making quite enough milk, which is usually a management problem, not actually a physiological problem, that we can give them the support that they need to be successful.
If you're pregnant, breastfeeding, or know someone who is, here's some important information. Babies are born to be breastfed. Why is breast milk better than formula? Formula-fed infants have a greater risk of infections, illnesses, and SIDS. Formula-fed children have a greater risk of obesity, diabetes, asthma, and cancer. Formula costs more. WIC does not supply all the formula your baby needs. What you can do before baby comes. Learn as much as possible about breastfeeding before your baby arrives. Attend WIC or other breastfeeding classes. Talk to your healthcare provider, your employer, and your family about your decision to breastfeed and how they can support you. Getting off to a good start with breastfeeding. Breastfeed your baby as soon as possible after birth. Putting baby skin to skin on mom's chest helps baby learn to breastfeed. Breastfeed your baby every 1 to 3 hours based on your baby's early hunger cues. Allow your baby to breastfeed as often and for as long as he or she needs. Avoid giving bottles and pacifiers in the first month. Giving bottles early can make breastfeeding harder for your baby and make you produce less milk. Breastfeeding is easier with support. Talk with your healthcare providers, employers, and family. Seek help from WIC or other organizations for breastfeeding problems. WIC can provide a breast pump at no charge. Where to find more information about breastfeeding? WIC Breastfeeding Peer Counselor Program, 473-4042. Marin General Hospital Lactation Center, 925-7522. La Leche League of Marin, 721-2842. Marin Breastfeeding Coalition, 663-8335. If you have any questions, call 473-3094 or talk to the resource specialist at the Connection Center for more information. Here's one more resource, the Marin Breastfeeding Coalition. Check it out online. Thanks for watching Connect. I'm Sio Hernandez, reminding you to listen with all your senses, know your communities, and connect.